you do not have to be overweight to be unhealthy or to have bad metabolic health. Furthermore, you do not have to be overweight to have high blood pressure or bad cholesterol. And finally, and importantly, you do not have to be overweight to have a heart attack, cancer, or dementia. And so a fundamental message that I am here again to promote is the importance of moving beyond calories in versus calories out, with recognition that 100 calories of sugar does not affect the body the same as 100 calories of olive oil, that there are different metabolic and health outcomes. And so on this subject, it is important for us to move beyond the tunnel vision of obesity in the message of calories in versus calories out, and instead turn a page to what I describe as comprehensive metabolic health, which considers a far more diverse array of risk factors than obesity alone. And so in looking at comprehensive metabolic health, the hallmark characteristic of poor metabolic health is insulin resistance, prediabetes or type 2 diabetes, belly fat or fatty liver, cholesterol patterns of inflammation with particular attention to triglycerides, HDL cholesterol, ApoB containing lipoproteins, and Lp(a), the latter of which are frequently not measured in the traditional healthcare setting or primary care offices. Beyond that, high blood pressure and systemic inflammation, all of which deteriorate good health and instead contribute to a disease state known as metabolic syndrome. And so metabolic syndrome contributes to weight gain, cellular aging and injury, and blood vessel damage, all of which contribute to the occurrence of heart disease and stroke, type 2 diabetes, Alzheimer's dementia, vascular dementia, depression, at least 13 different cancers, for which, taking a deeper look into this, we see that cancer is negatively influenced by poor metabolic health, including cancer of the esophagus, stomach cancer, liver cancer, gallbladder cancer, pancreatic cancer, kidney cancer, colon and rectum cancer, thyroid cancer, breast cancer, uterine and ovarian cancer of women, and then finally, even cancer of the brain, a subtype known as meningioma. Beyond cancer, however, the list continues with kidney disease and end-stage kidney disease resulting in dialysis, liver disease and cirrhosis, heartburn or gastroesophageal reflux, arthritis and gout, acne and various infections including diabetic foot ulcers, infection of the gallbladder, appendicitis and diverticulitis, infertility and low testosterone, preeclampsia and pregnancy loss, polycystic ovarian syndrome, and then finally asthma and obstructive sleep apnea. And then in comes severe COVID-19 infection. Individuals with metabolic syndrome and its risk factors were at the highest risk of hospitalization and severe outcomes. Beyond that, metabolic syndrome can worsen or exacerbate several diseases, including autoimmune illnesses and inflammatory bowel disease such as Crohn's disease or ulcerative colitis. And so finally, if you have high blood pressure, insulin resistance, or any of the risk factors of metabolic syndrome, it's not necessarily the case that you will develop each and every one of these pathologies, but rather perhaps it's your genetic predisposition that walks you down the plank of heart disease and stroke, whereas your neighbor the plank of polycystic ovarian syndrome. And so the comparison that I make here is with tobacco use. We know that tobacco use contributes to lung cancer. However, the majority of individuals who smoke tobacco will never actually be diagnosed with lung cancer. Meanwhile, we know that tobacco use contributes to other issues like COPD, emphysema, heart disease, head and neck cancer, and esophageal cancer. So in the event that I smoke a pack of cigarettes per day and you smoke a pack of cigarettes per day, perhaps it is my unique genetic predisposition that leads me down the plank of lung cancer, whereas it leads you down the plank of emphysema. And so this being an example of the same risk factor contributing to different medical outcomes, and we can apply the same to poor metabolic health and metabolic syndrome. And so a simplified list that I promote to minimize or eliminate added and refined sugars, with the most common examples just being sugar and sweets, desserts, followed by the consumption of extraordinary quantities of sugar in liquid form, whether it be Coca-Cola, various coffee drinks, and even a lot of juices. Juices themselves may be natural, plant-based, no saturated fat, no cholesterol, contains vitamins. However, in looking at a nutrition label saying 23 grams of added sugar, for example, would not be advisable. Beyond that, we minimize or eliminate white, flour, and highly refined carbohydrates. A plate of pancakes here, the cereals that many of our children eat, potato chips, Cheez-Its, and other snack-based foods. Beyond that, deep-fried foods and hydrogenated oils, including French fries and chicken tenders. Cured, highly processed and corn-fed meats, hot dogs, and other highly processed meat products being a great example of foods that we should minimize. And then finally, alcohol and tobacco, both of which are known carcinogens. Beyond that, I will advocate again that your health is the single most important investment of your life, and you should care about it. Thank you for listening.